Welcome to the Counselor Soapbox video channel. Today, part 8 in the Learning About Alcohol series, Alcohol Use Disorders. What's an alcohol use disorder, and when does using alcohol become a problem? Our attitudes towards alcohol use have changed. Getting drunk is not seen as a right anymore. The results of being drunk are not seen as simply accidents. Being drunk is not an acceptable excuse for bad behavior. Drinkers' actions affect others' lives and enjoyment of their lives. Alcohol use disorders are common. Alcohol use disorders affect over 18 million people in the United States. And alcohol use disorders affect others. For every one alcoholic, 4 to 8 other people are affected. Those could include parents, children, partners, people you work with, and people that you are responsible to. Not everyone with an alcohol use disorder is alike. Only the most severely impaired people end up homeless and unemployed. Many alcoholics continue to have full-time jobs. Throughout history, many theories have been proposed as to why people have a drinking problem. Are they morally defective? Are they crazy? Are they possessed by demons or evil spirits? Is alcoholism a disease? Not everyone who has an alcohol use disorder has the same symptoms, and not all alcoholics develop DTs when they stop drinking. Because problems with alcohol can vary so much from person to person, it's been very difficult to define alcoholism or alcohol use disorder. Some of the early definitions include AA's definition, an obsession of the mind and an allergy of the body. Jellinek defined it as use that causes damage to the individual or to society, or both. The World Health Organization has defined it as any intake beyond normal cultural or dietary intake. And the APA, American Psychiatric Association, in 1968 defined alcoholism as the intake that is enough to damage their physical health, impair social or personal functioning, beyond what is needed for normal functioning. 3 types were defined in the early literature: episodic, habitual excessive drinking, and addiction. There have been efforts to standardize terminology when it comes to drinking problems. The World Health Organization includes it in the International Classification of Diseases. Some areas are using the ICD-10, and now it's moving towards the International Classification of Diseases 11th edition. The APA, Diagnostic and Statistical Manual of Mental Disorders, uses the International Classification of Diseases numbers, but adds descriptions and specifiers. More about defining alcoholism. It's the World Health Organization which produces the International Classification of Diseases, whereas the APA, the American Psychiatric Association, not the APA which produced the APA format for papers, they have a different diagnosis. They produce the Diagnostic and Statistical Manual of Mental Disorders. The DSM-4 was what many people were trained on, which has now become the DSM-5. And that defined things as impairment of social functioning, impairs occupational functioning, causes subjective distress, or harms another important area of the person's life. There are other groups who have influenced addiction, alcoholism, definitions, and treatment. The AMA, American Medical Association, defined it as impaired psychological, physiological, or social functioning. ASAM, the American Society of Addiction Medicine, has developed a patient placement criteria to define who needs treatment for alcoholism or addiction and how much treatment is appropriate. Inclusion of alcoholism in both the Diagnostic and Statistical Manual and the World Health Organization International Classification of Diseases implies that alcoholism is a disease. There has been some criticism of this as a disease model. For the disease model requires three things: a host, in this case the person, an agent, a bacteria, a virus, etc., and an environment where the two come together. Implications of the disease model include it suggests it is treatable as opposed to a choice. People do not ask to be sick. It implies control of symptoms rather than a cure. Alcoholism and addiction is currently treated as a chronic, possibly fatal, but recurring condition if it is not treated. What's ahead for the Counselor Soapbox video channel? More learning about alcohol videos, more drug education videos, and some mental health and wellness videos. If you've enjoyed this video, please click the like button directly below and subscribe to receive new videos as they are completed. For more information, please visit the Counselorssoapbox.com blog, where you will find articles on mental health, substance abuse, and having a happy life. The David Joel Miller fiction and nonfiction books are available on Amazon.